Hi everyone, I am Dr. Karthika Krishna Kumar, consultant endodontist and director at Metier Multispeciality Dental and Polyclinic, located at Vidyaranyapura, Bengaluru. You are crunching ice or a piece of hard candy when you notice something hard in your mouth that does not melt or dissolve. When you remove it, it's a piece of your broken tooth. Although the enamel that covers your tooth and protects the tooth is the most hardest, most mineralized tissue in the body, but its strength has its own limit. Falling or receiving a blow to the face or biting on a something hard item, particularly if the tooth is already damaged due to decay, can cause a tooth to chip or break. If you discover you have a broken or a chipped tooth, do not panic. See your dentist as soon as possible. Otherwise, your tooth could be damaged further and become infected, possibly causing you to end up losing the tooth. In the meantime, try the following self-care measures. That is, if the tooth is painful, take a pain reliever, rinse your mouth with salt water. If the fractured area or the broken area is sharp or has a jagged ends, use a wax or a paraffin wax to coat it so that you can prevent the sharp edges injuring your oral structures. If you have to eat soft diet and avoid biting down on that broken tooth. Treatment for broken tooth or a chipped tooth will depend on how severely it is damaged. If only a small piece of enamel is broken or chipped, it can be repaired by doing a simple procedure of bonding or a dental filling. If you have a chipped off small piece of tooth enamel, your dentist will repair using a composite filling and build it up to look like a normal, natural, healthy tooth, and also helps in restoring its form and function. If the fracture or a broken area is little large, it might require a dental cap or crown. There are different types of dental crowns, that is metal fused with ceramic or all ceramic crowns. Depending on the strength and the amount of tooth structure which is damaged, the type of crowns can be chosen. Next is dental veneers. If a front tooth is broken or chipped, a dental veneer can make it look a whole and healthy tooth again. A dental veneer is a thin shell-like of tooth-colored porcelain or resin composite material that covers the whole front of the tooth with a thicker section to replace the broken part of the tooth. Next is the root canal treatment. If a tooth broken is large enough to expose the pulp, the center of the tooth containing nerves and blood vessels, bacteria from mouth can enter, causing the inflammation or infection or even the death of the pulp tissue. It can also cause changes of the tooth color, and it can also be sensitive to heat. The pulp is probably damaged or diseased. The pulp tissue can die, and if it is not removed, the tooth can become infected and needs to be removed. Root canal treatment involves removing the dead pulp and cleaning the root canal and also sealing it, thereby trying to save and retain the natural tooth structure. After this, it will require a cap or a dental crown over it to prevent it from further fracturing and helping to retain its strength and form and function. The next is the treatment of a broken or a knocked out tooth. That is, in case if due to a fall or an injury, the entire tooth is removed from the oral cavity. A knocked out permanent tooth is a dental emergency, and it can be re-implanted if we have the tooth fragment in most of the cases. A permanent tooth that is re-implanted within 30 minutes has a highest chance of recovery and has a chance of success. So what has to be done in such cases? Collect teeth or teeth fragment. Handle the teeth carefully because damage may prevent re-implantation and can also cause a failure. Touch only the crown part, that is the top part of the tooth. Do not touch the root of the tooth because it has fibers which help in the success of reimplantation. Rinse the tooth gently in a bowl of lukewarm water for not more than 10 seconds only if there is a dirt or foreign material on it. Do not scrub, scrape or use alcohol to remove the dirt. Next is to reinsert or to store teeth. Rinse the mouth with warm water. If possible, reinsert permanent teeth into the socket correctly and have the person bite on the gauze pad to hold the teeth in place. If you can't reinsert permanent teeth, or if in case it's a milk teeth or the baby teeth, store them in whole milk or between your cheek and the gum area to prevent drying. Next, to treat the symptoms. Control bleeding with the sterile gauze or cotton. For pain and swelling, apply cold compress, that is ice pack, and encourage the child to suck on an ice pop. For pain, they can also take a pain reliever. For teeth that have been knocked out, see a dentist or go to emergency room right away. Take the teeth or teeth fragments with you. Even if the teeth have been reinserted, you should see a dentist to prevent further infection or to correct the alignment of the teeth if needed. And hence these are the way your broken or chipped or a cracked tooth can be treated. In case you have a minute crack or a chip and you notice it, seek your dentist help immediately and do not wait for its damage to get worsened and loss of tooth eventually. Thank you.